Welcome to the Marion Public Health Conversation about Lead. The League of Women Voters is proud to promote this forum to increase awareness of the dangers of lead poisoning. Co-sponsors of this event are Marion Public Health, Ohio Healthy Homes, and the Ohio Department of Health.
We are grateful for the support of our community and invite you to support the League for your generosity. Also, we invite you to join the League. See one of our members tonight or email us at marionleague@yahoo.com.
And now we're proud to introduce Marion Health Commissioner Tom Quaid.
Thank you very much, and thank you all for coming out on a less than sunny night here in Marion. It's nice to see a room full, and we're glad to have you all here with us. I'm just going to take one moment and introduce our panelists this evening. Some I know very well, and some I've just met. They're all experts in their areas, so I'd like to introduce them to you. First up this evening, we're going to have Chris Alexander, the Program Supervisor from the Lead Poisoning Prevention Program at the Ohio Department of Health. And he's going to give us an overview of lead poisoning and how it impacts health, risk review at the local level. Then we'll have Roxanne Summerlot, Director of the Marion County Job and Family Services, and she's going to talk about the role of Marion County JFS as it pertains to lead poisoning. Next, Dr. Leonard Jankar, who is a local pediatrician and is also, we're fortunate to have him on staff at the Marion Public Health Department as our medical director. He's going to talk a bit about provider requirements for lead testing, as well as barriers to lead testing. And then finally, Elaine Lawson, who's our nursing director at Marion Public Health, and she's going to talk a little bit about the Marion Public Health lead case management process. Again, thank you all for being here, and at this point, I'd like to pass it right on over to Chris.
Thank you very much for the introduction. First of all, I'd like to thank Marion County Public Health and the League of Women Voters Marion for having me here today to talk about this important issue. Again, my name is Chris Alexander. I'm a program supervisor with the Ohio Healthy Homes and Lead Poisoning Prevention Program. I've worked in the program for about 10 years and worked in many areas of the program, but mainly the areas of surveillance and program supervision. I have a short presentation for us here today, but I also have some information I can provide to those who attended us here in person after the talk today. We probably all know about the effects of lead on the human body. Unfortunately, lead affects all of us. It affects children and adults, and has been shown to affect nearly every system in the human body. Countless studies have continued to make this clear that lead has no physiological function in the human body, and it only causes us harm. Most lead poisoning symptoms are honestly not going to be noticeable. They can be linked to many other possible issues, but many times children, especially who are lead poisoned, are shown to be irritable, have hyperactivity, an overall reduction in their IQ, learning disabilities, trouble doing well in school, behavioral problems. At higher levels, unfortunately, we did see a lot of high levels in this state and really across the country up until recently. We can have children even die from lead poisoning, which is tragic. Luckily, we don't see a whole lot of the high lead levels in the state of Ohio anymore. We do see some extremely high levels in the hundreds or even greater in the cities of Cleveland, Cincinnati, Toledo, but not many in our smaller cities and counties. It is estimated 230,000 people do die of lead poisoning every year. Many of those are in Africa and Asia. A lot of disturbing stories recently out of Nigeria, but lead does still kill, unfortunately. One of the most commonly talked about effects of lead, and really the effect of lead on children that we are concerned about on a day-to-day basis, is the effect on the developing brain. It has been shown that children with elevated blood lead levels, or really any lead level at all, it can have an effect on their IQ, which obviously leads to a lot of other issues. So as I kind of mentioned already, Ohio is a state that is continually plagued by this problem. We do have a lot of older housing in Ohio, a lot of housing built before 1978, which is when lead was banned for residential use, for lead and paint, I should say. We have a high percentage of homes built before 1978 in this state, as well as sheer numbers of them. And when you look at the national statistics, we're one of the fourth worst states when it comes to the number of children who are found to have a lead level over what is commonly referred to the reference value for childhood lead poisoning. We'll talk a little bit about that in a moment. So we worry about very small children when it comes to lead poisoning, not only because lead has the greatest effect on the developing brain, and very small children's brains are developing much faster than us adults and even older children, but we know that their behavior leads to them to be lead poisoned as well. You can be lead poisoned through ingestion or inhalation. Typically our small children, so our children that are in the ages of 1 and 2, who are crawling on the ground, are poisoned by lead dust. Lead dust is generated when lead-based paint begins to deteriorate. Lead-based paint was commonly used on exteriors of homes, but also on windows, window sills, doors, window frames, railings, banisters, porch floors, porches in general. All the exterior surfaces of houses were typically painted with lead-based paint when it was commonly used, again, before 1978. But it is the dust that we're most concerned about. I have a great visual aid that I'd be happy to show everyone later after the formal presentation is over. But the amount of lead dust it takes to poison a child is quite small. In fact, it's almost invisible amount of dust we're talking about. Many of our homes that were built before 1950 have 50% lead-based paint, so 50% of the paint is lead. It takes, again, an invisible amount almost of this dust to poison a child. Lead in soil is a topic we started to talk a lot more about now that we're worried about children with much lower levels of lead than we were previously. We know that lead in soil plays a significant factor in really all lead levels we see in humans. Lead is somewhat ubiquitous in our environment due to the burning of leaded gasoline for many decades. Lead has been deposited nearly everywhere, including the Arctic and Antarctica. And it's almost impossible to avoid. During the dry seasons, lead dust is generated from our soils, bare soils in particular, and that lead dust makes its way into our homes quite easily. So we do take soil samples in many cases when we're doing our investigations, once we identify a child with lead poisoning, and often find those soil levels to be elevated. One area in particular that we're concerned about is the drip line of a house. As a house receives weathering such as rain, we know that lead-based paint is sloughed off the home and falls on that drip line around the perimeter of a property, and can be quite high in its lead content. Lead in occupations, you would think this is just an occupational health issue. Unfortunately, it is not. I talk to families on a probably weekly basis that are bringing lead into their homes because of their occupations. Typically, we're worried about folks that work in construction or manufacturing. These folks are exposed to lead dust through their everyday work activities, and they bring it home on their clothing and even their own skin, hair, cars, anything that they have with them at the work site. This is something that has become a bigger issue as we start to look at lower levels of lead in children. We have seen that in many of our families with children which have quite low levels of lead in kind of historical sense, many times we do not find the lead paint dust hazards present, but we find occupational take-home exposures, and that's becoming somewhat difficult to deal with, but we can do a lot of education with families like those. Lead in hobbies is something that we are less concerned about in this state, but we do see from time to time folks who do either refinishing of furniture or remodeling of homes, folks that make their own fishing lures or cast their own bullets within their homes. They can create a lot of lead dust. This can cause childhood lead poisoning and, of course, adult lead poisoning as well. Toy recalls. Sometimes we worry this is a bit of a red herring, but it does seem to generate a lot of interest in the issue. We have had many families call us as a result of stories in the media about toys from China in particular with lead in them. For those of you that follow lead, you may have recently seen some articles about toys from the 1970s and 1980s being tested, and many of those being found to have quite high lead content. Whether that's actually in the paint or in the materials themselves the toys are made out is sometimes hard to say, so you're not sure if that lead is necessarily available to be ingested very easily at least. But we are seeing that as kind of a new story again, as kind of new parents and grandparents take toys out of attics and basements and closets. We have to worry about some of those older toys now too. But as you can see on the screen for those in the room, several of the Thomas the Train toys were actually recalled at one point in time, which again generated a lot of interest in this subject. But unfortunately, most of our children aren't going to be saved by just recalling these toys. We have a big lead-based paint issue in our state, but I do like to talk about lead. So most children, as I mentioned earlier, are asymptomatic. You can't look at a child and find out that they are lead poisoned. You must test them. Blood lead testing is the best way to determine what someone's lead burden is in their body. We have what we call capillary testing or capillary screening done quite regularly in this state. This is typically used because it's much easier and children are more likely to sit still for a simple capillary test, a finger prick or a heel stick type test. But when children are found to have lead levels that are equal to or greater than 5 micrograms per deciliter, which is just a concentration of lead in blood, and it's again a very historically quite low level, we do want to make sure they're tested by a venous draw, so actual blood samples collected, a much larger sample from the vein, and those are analyzed, and the results are much more accurate to determine the true concentration of lead in that particular child. So one of the nice things about our state is that we do have mandatory blood lead reporting, blood lead testing results reporting, I should say. It's required that any laboratory that does any kind of analysis on human blood for the concentration of lead, they must report that lead result along with a lot of other information on that particular child to the Ohio Department of Health. We receive all results regardless of the patient's age, regardless of the actual result level itself. That information makes its way to the Ohio Department of Health, where it's imported into quite the robust case management surveillance system, which we call the Healthy Housing and Lead Poisoning Surveillance System. Within that system, we generate our cases, we generate our investigations, and we use that information to do all the work we do, and even get those referrals to the folks here in Marion City and Marion County to make sure that we go out and provide the services that those families are due. This is typically a combination of a home visit from a public health nurse and also an investigation by a licensed risk assessor who is also a public health lead investigator, so has additional training to go out and identify all the likely sources of lead in the child's environment. Those sources of lead are identified in what's called a lead hazard control order. It's required that the property owner control or abate all those hazards within a given time frame. Otherwise, what we can issue is a notice of non-compliance, which actually then vacates that property until all that work is done. So the burden is on the property owner to make sure those properties are now free of lead hazards. All those lead hazards must be controlled. We do have grant programs in many areas in the state to help pay for that, but there are areas that lack that funding. Thank you. Just to give you a little bit of idea of how many children are tested each year in the state of Ohio, we have this graph on the screen. Roughly 150,000 unique children are tested for lead every year in the state of Ohio. I was pulling up some stats while the introduction was going on, and I can tell you that in some of the worst census tracts in Marion County, where we would expect quite a large percentage of children to have lead levels greater than or equal to that 5 micrograms per deciliter, that level which we do intervene, and we do want to see retesting and confirmation testing on children. Only about 20% of those kids are being tested. So 20% of the children in those census tracts, we expect to have a high lead level, and only 20% of those kids are being tested. So the testing numbers are quite low. We'd like to see that obviously increase. Looks like it's working now. I'm going the wrong way, sorry, everybody. The good news is the number of children with high lead levels or lead levels greater than or equal to 10 micrograms per deciliter is sharply declining over time. We are around 0.8% of the tested population under age 6 is showing with a lead level greater than or equal to 10 micrograms per deciliter. That's somewhat the historical definition of childhood lead poisoning at 10 micrograms per deciliter. So less than 1 in 100 children is showing up high, which is good, but we have leveled off, as you can see from the slide here. There are some things we can do to help families and help children with lead poisoning. It's all about reducing exposure, reducing absorption, and making sure that remodeling and renovation projects are done lead safe. Household cleaning techniques do have some ability to help reduce lead levels in homes, although it's somewhat misleading because cleaning will not solve the lead problem. Lead control and lead abatement and lead removal are ultimately the way to prevent a child from being poisoned or to reduce that level, but wet cleaning methods do help. This is just making sure that we don't move that lead dust throughout the property as we do that cleaning. So not using a traditional vacuum cleaner and making sure that we get everything nice and wet before we do the cleaning. Hygiene, again, is not going to solve the problem, but we do know that most lead poisoning is that hand-to-mouth behavior, so making sure a child's hands are clean, making sure they're clean, their eating area is clean, that the toys are kept clean can help reduce the child's lead level and prevent them from being poisoned in the first place. Nutrition and diet is also important. Diets that are high in calcium and iron have been shown to help reduce the child's lead level and also decrease absorption of any new lead. Renovating and remodeling homes before 1978, we need to be very careful when we do this type of work. There are quite a bit of educational materials out there, and really the ultimate solution is making sure we're following lead safe practices when doing remodeling, following the EPA's renovation, repair, and painting rule, which our contractors are now required by law to follow whenever working on a pre-1978 house, which requires them to do notification of families of lead hazards and also to work lead safe, which is mainly just preventing the lead from really moving throughout the property. Containment is key, doing good cleaning to make sure any lead dust that was generated is cleaned up. Get stuck in the context. So we talked a lot about different levels of lead in humans that are considered to be lead poison or reference value. There really is no safe level of lead in humans. None has been identified or found. The reference value for childhood lead poisoning that was developed by the CDC and has been adopted by the Ohio Department of Health has nothing to do with nothing to do with the lead level at which no effect has been found underneath that 5 micrograms per deciliter. It was quite simply just a good cutoff point where 97.5% of the population tests below 5 micrograms per deciliter, so that's where the reference value is established. The reference value for childhood lead poisoning is now been adopted into Ohio rules, and so again, that's the level at which we do confirmation testing, making sure children are retested as well, and we're using that for identifying areas of greatest risk, and we'll talk about that in a moment. We've done a lot to adapt our guidance to this new reference value and to these new rules. We no longer consider any lead level to be a level of concern. We have lowered, though, the definition of childhood lead poisoning in our rules at the Department of Health to 5 micrograms per deciliter. And again, we will require that confirmation testing is done for children with capillary levels at or equal or at or greater than 5 micrograms per deciliter, and making sure those children are also tested as well. Next slide, please. Thank you. So this brings me to our new guidance for childhood lead poisoning. I do have some copies of this document up here for those in the room later today. This just helps us to determine which children should be tested. So we talk a lot about in Marion County there are several high-risk census tract areas. We expand those census tract areas to high-risk zip codes, and in Marion County there are 2 high-risk zip codes. So all children in ages 1 and 2 should be tested in zip codes 43301 and 43302. In these zip codes, we know that there's at least one census tract with a predicted probability that a child would be lead poisoning at about 12%. So more than 1 in 10 children will have a lead level equal to or greater than 5 in those census tracts. So we've expanded those census tracts to the zip code level. We still have mandatory Medicaid testing for children in ages 1 and 2 as well. So all children that live in Marion or anywhere in the state of Ohio do need to be tested at 1 and 2 if they're on Medicaid. And then we have several what we refer to as risk assessment questions that help us determine whether a child should be tested. This is our screening tool that goes beyond just the zip code status and the Medicaid status. And these are questions about the age of the home that the child lives in or the age of the properties that they spend a significant time. If they're built before 1978 and there's any peeling, chipping, paint, or recent ongoing renovation, we want to make sure those types of children are tested. If they live in a pre-1950 home, no matter what, we want to see those children tested. If they have a sibling or playmate who has lead poisoning, we want to see them tested. If they come into contact with an adult who has a hobby or works with lead, we talked about that take-home exposure earlier, we want to see those children tested. If the mother is known to have a lead exposure during a pregnancy, or if she's an immigrant or refugee, we want to make sure those populations are tested. They have been shown to be at a greater risk. And finally, if a child lives near an active or formal lead smelter, or battery recycling plant, or any other type of facility known to work with or release lead into the environment, we want to see those children tested as well. So we talked about the high-risk zip codes. That's the back side of this document. So if you're here from one of our neighboring counties, you can also look and see the high-risk zip codes in those areas. Next slide, please. We've also updated our medical management recommendations for children that do have that confirmed blood lead level at or greater than 5 micrograms per deciliter. Really, we've just shifted the guidance down so that levels as low as 5. We're making sure that we're monitoring their blood levels over time, doing a complete child history and physical exam, assessing iron status, obtaining x-rays if necessary, doing all referrals to our sister programs such as WIG, BCMH, Children with Medical Handicaps, Help Me Grow, and again, just making sure those children are tested on a regular interval. Again, I have this document available for anyone who would like to see it that we're done today. One last thing I will mention, I did say that the 5 microgram per deciliter definition, or that reference value for child lead poisoning, is not necessarily a level at which we now do government intervention, but we are now offering a combined questionnaire to those families and providing education to them over the phone when they test at or greater than that level. We are able to receive medical or Medicaid reimbursement for that activity, and so a lot of our counties and cities that work with us to do public health lead investigations are now doing that on our behalf and seeking reimbursement when working for Medicaid children.
Thank you very much, Chris. I appreciate your Roxanne from Jobs and Family Services is up next. So I'm going to stand up here unless you get here. Thank you.
Thank you. I'd like to thank Tom for the invitation this evening, and certainly the League of Women Voters for sponsoring this event. The League is always, and I might be a little biased, but the League is always instrumental in ensuring that we have an informed citizenry in our county, and that we have relevant topics that that all of us can share and learn from. So when Tom asked that I speak a little bit about the role of Job and Family Services as it relates to lead poisoning or lead poisoning prevention, most accurately, I was happy to do so, and in the course of preparing, I did learn a few things, as I hope that we all will before the evening's over. And our role as Job and Family Services really centers around our role in providing administration of our county's Medicaid program as it relates to eligibility. And just the most current roles, although they change every day, approximately 29% of Marion County's total population is enrolled in the Medicaid program and uses Medicaid as the form of insurance for that individual. 19,000, a little over 19,000 of those people are children and families, or about 68%. So the majority of people that are enrolled in the Medicaid program are younger, are children and families, and at one point, the ratio of births that were covered by the Medicaid public health insurance program in Marion County was right around 50%. So many children are covered through the Medicaid program. And the Medicaid program itself, when people talk about Medicaid, Medicaid is a term, but it encompasses about 21 different programs. Each one has a little slight difference in eligibility and in services provided. One of the programs that is part of the Medicaid program that is specifically offered to young people and pregnant women actually, so from 0 up to the age of 21, is Health Check. And Health Check is really a basket of services that is provided through Medicaid for people as an early screening program. The goal of Health Check is to provide early detection and early treatment, and it encourages and provides higher reimbursement for those providers that perform Health Check services. Some of those things that are in Health Check baskets are vision screening, dental screening, developmental delay screening, mental health screening, but as it relates to tonight's conversation, we'll be focusing on the screening for lead toxicity, or the blood lead testing that Chris spoke about. So lead poisoning, Ohio made lead poisoning a priority several years ago. And the statistic we're looking at now is nearly 70% of Medicaid eligible children younger than 6 live in zip codes where there's a high risk for lead poisoning. And as Chris mentioned, our 2 most prevalent zip codes are also the most prevalent zip codes for our Medicaid clientele as well. And as Chris mentioned, there is a mandatory, it's been codified in the state of Ohio law, that children at 1 year and at 2 years be tested for lead. Although that is mandatory, and Chris mentioned that there is still low take-up on that testing, what we do in our role in Job and Family Services is that we have a role of informing and then supporting. So at the point that a family applies for Medicaid, and they do that either by coming into our agency or over the phone, or we have the ability for people to apply online. At that point of application, what our eligibility specialists do is explain the health check and the Medicaid program to those that are applying, and ask at that point of time if they're interested in receiving more information, and specifically receiving a reach out to make arrangements for health check services. I will say that Ohio has 5 managed care plans that operate the Medicaid program for children and for young families. Each of those programs, the Medicaid contract with the state, includes also informing about that health check program. We also rely, for the informing side, on our partner or sister agencies and programs such as WIC, Women, Infants, and Children, and also the Help Me Grow program. How many people know what Help Me Grow is? I think we have a loaded audience tonight. Help Me Grow is a home visitation program, and I think that that's particularly relevant because we have people that are in people's homes and can identify signs or identify situations where lead may be a hazard, and that is very important for us to get that referral out to that person and make sure that they are lead tested for those children. On the support side of what Job and Family Services does is what we can do for someone that is looking for services, needs to get to a doctor, would like to have their child tested. We can arrange for, provide transportation if they have no transportation, or if they are seeking reimbursement for fuel. If they have a car, but they need reimbursement for gas to put in that car. We also can provide coordination with the managed care group that they're involved with, make that call, make sure that they get set up with an appointment, and make sure that the managed care group that represents them is aware that they need those particular services. And we also provide access to other kinds of supports, meaning other kinds of situations or services that family may need, whether it be food or housing, clothing, other kinds of supportive services. And I had, every county in the state of Ohio has a Job and Family Services agency, and every agency has what we call a health check coordinator, a person in that agency that is responsible for keeping track of those people that request health check services. And in the specific case of lead poisoning, we receive through our agency every time the health department, and the Department of Health and our local public health professionals are the leads in the issue of lead poisoning prevention. When an incident is reported through the health department and it is a Medicaid eligible family or child, we receive notification of that. And oftentimes we work with the public health department to coordinate services or try to put our resources together in support of a case management event. We recently had a situation, and I'm going to call her Lucy for HIPAA regulations. Her name is going to be Lucy tonight. We had a report of a lady that was a grandmother caring for several of her grandchildren, and through some referral or through a screen that she sought out herself, there revealed some toxicity in the levels of the blood of those children. So through the health department's intervention, we found that Lucy owned her home, so that situation was not that she, typically most of our Medicaid clients rent and don't own. So in that case, many times what people will do is seek an alternate housing situation, and we can help with funding that. But in this particular situation, Lucy owned her home, so she couldn't really go to another place. She was in a home that she owned. She didn't have a rent payment, so in her case, her avenue was going to be lead abatement. And at the time that the lead abatement activity was coordinated with the health department, Lucy, our role in that situation, that is that through our another program that we operate, we were able to cover the cost of Lucy and her children staying in another house temporarily until her own home was suitable for her and her grandchildren to move back into. And as I mentioned, we have a health check coordinator, and what I've done in the very back on the rear table, I've left cards for that individual along with some material pamphlets and actually applications for the health check services. So if you work with people, with families and young children that may be eligible for Medicaid, then there are applications at the rear table. If they haven't requested those services specifically, they can do that. And I've also included some prepaid envelopes in the event that they need to mail them back into us and don't have the opportunity to drop them in. those are available to you. But Linda Pfeiffer is our person who acts as our health check coordinator, and she is familiar with our public health professionals and work with them. We're lucky to have them as part of our team. And Linda can be contacted for more information. And I just would like to entertain questions at the end if you have any questions. Thank you.
Thank you very much. Pull the slides back up for Dr. Jankar. Dr. Jankar, you with please. Dr. Jankar is our medical director at Marion Public Health and is a local pediatrician, and so he's going to share his wisdom.
Thank you, Tom. One of the advantages of being further down the list on a program like this is you get to use some of the material that the people before you have done. And Chris did an excellent job of outlining what the problem is and our job of trying to pick up those kids who need to be tested. And Roxanne did an excellent job again of trying to show the support that we have for our most at-risk population. But I've been a practicing pediatrician here in Marion for 39 years, and half of my patient clientele is on Medicaid. What I was assigned to do was to list the provider requirements for lead testing and talk about some of the barriers to lead testing. So regardless if you're on Medicaid or not, test all 1-year-olds and 2-year-olds, regardless of what your insurance is. One thing about insurance is it keeps changing. So some parents have it, some parents don't have it. First of the year comes, there's going to be different insurance. The easiest way is test all 1- and 2-year-olds. If you look at some of the requirements that commercial health plans have, Anthem, United Healthcare, they will list that as a requirement for your 1- and 2-year-olds. You look at the gold standard from the American Academy of Pediatrics for health prevention and participatory guidance in kids, lead testing at 1 year and 2 years of age. Another thing to think about is what kind of conditions that lead poisoning could be responsible for. Anemia is one of those. Iron deficiency anemia, for example. And frequently kids, because of a poor diet, don't eat the things that they need. They eat other things like the dirt in the ground that has the lead in it. Certain developmental disorders, Chris outlined about developmental delays that kids with growth failure can have with lead poisoning. So regardless of the age, these are kind of things to think about and also test the kids for. Immigrant, refugee, foreign adopted children should all be tested for lead poisoning. Various products that are imported can contain lead. Folk remedies, toys, cosmetics in foreign countries are lead-based. Children's Hospital has an international adoption clinic. They do an excellent job. This clinic's been around for over 20 years now. And when the influx of the adoptees started coming into the United States, Nationwide Children's saw a need for it and set this clinic up. And that is part of one of the screening things that they do is the lead testing in these kids. Chris also mentioned about parents who maybe have an occupational exposure to lead where they may work or they may have a hobby on that. Again, these are questions that you need to ask the parents, and frequently when you see what the parent is dressed in when he brings the kids in the office gives you an idea what their occupation is, what assembly line that they may work on, which manufacturing company that they may work for also. The next thing I want to talk about is barriers to lead testing. One of the first barriers I want to talk about is parental opposition. The first one is just outright refusal. I don't want to have it done. Most of the time, the reason for that is they don't understand why we're doing it. And a lot of the things we do in pediatrics are screening. We're trying to prevent things. We're trying to prevent growth failure. We're trying to prevent that low IQ that's going to happen because of exposures to lead. So by explaining to the parent what we're looking for, that is a good reason to get parental cooperation. Non-compliance. This takes two forms. First form is not showing up for your appointment. So if you don't show up for your 1-year-old or 2-year-old child's checkup, you're not going to have his lead tested. And there is a high rate of appointment failures in the high-risk population that we talked about tonight, the Medicaid population. And noncompliance also takes a second form. You hand the parent the lab slip to go to the lab, the parent walks out of the exam room, never goes to the lab. That's another form. The technical barriers, we have found that if you don't have one-stop shopping for healthcare, it makes compliance harder. So the place I work, we got a lab downstairs on the first floor. That makes it easy. By having the lab separately from the place that the child's being examined, it makes it a bit more difficult because the parents have to make another trip somewhere. Second thing is the discomfort associated with the blood drawing. Chris mentioned the two types of specimens that you can do, capillary testing or venous draws. We have gone, in my practice, to all venous draws. So we don't have to worry about bringing the child back to make another test because we use the capillary method. It requires more technical expertise on the part of your laboratory workers, but where I work, we have those types of laboratory workers. And they're very good about comforting the kids. They work with a lot of kids to do the blood draws, and it lessens the difficulties that sometimes the parents feel that's going to happen. The next thing I want to talk about is physician barriers. Why are only 20% of the kids in Marion who are in the high-risk census tracts being tested? Well, number one, maybe it's because the physicians aren't aware of those requirements that they need to be done, and that can happen. The high-risk zip codes that he mentioned, that's exactly the ones that need to be addressed. I see kids from a multi-county area, and if you look at the list that he mentioned, there's high-risk areas in Crawford County, Wyandotte County, Hardin County, and Morrow County, and I see patients from those counties. Not screening 2-year-olds. Physicians who may do the lead testing, they will certainly do it at 1 year of age, but they somehow forget about the 2-year-olds. And that's just because the 2-year-old doesn't really have a reason to come in. He's not going to get any shots. And you would think that 2 years of age is an age that is important for growth and development, speech development, for example, starting toilet training, social awareness. But for some parents, if he's not going to get shots, they won't bring him back till he's ready for kindergarten. The last shots they usually will get will be at 18 months. And you may not see that child again until he needs to go to kindergarten, get his physical, and get his shots again. But you need to screen the 2-year-olds, as it was pointed out. The final reason is inadequate reimbursement for blood lead screening. Some physicians may decide to do this in his office, charge Medicaid, for example, and not get paid adequately for the materials, the time that they have to do for the blood drawing. So they will not go ahead and do it on that. I think the biggest thing we need to do is, sure, take care of the barriers, but we have to remember we need to take something more important, and that's a primary prevention attitude to this problem. The kids are already in the houses. They're already exposed to it. So we have to ask ourselves, how can we keep the kids out of the houses that have the high-risk places in the first place? Thank you.
Thank you very much, Dr. Jones. And now I'd like to ask Elaine Lawson, our nursing director at the health department, to get up to the podium and talk a little bit about some basics of the lead case management. What happens when we find out?
Okay, Marion Public Health has an agreement with the Ohio Department of Health to provide case management services to children in Marion County with elevated blood levels. I'm the person who has the responsibility to provide this service. After I receive a report of an elevated blood in Marion County, I contact the parents by phone. For children whose lead levels are from 5 to 9, I'll call the parent to discuss the lead level and mail a brochure provided by WWGH containing lead poisoning information. For children with lead levels 10 and above, I'm required to make the initial phone contact with the parent within 10 days or sooner if the level is very high. During this phone call, I discuss the child's lead level and briefly discuss lead poisoning health risks and simple preventive measures, and then schedule a home visit. If possible, I try to schedule my visit with the ODH lead investigator, but it seems like it's hard to coordinate our schedules, so normally I make the visit on my own. And actually, we're lucky in Marion, the physicians call us with those lead levels, and we sometimes get the results quicker than ODH does, so it seems like I can get out there a little bit quicker than the lead investigator. And then during my home visit, I administer the medical developmental part of the public health lead investigation and case management questionnaire. I administer an environmental assessment using the Healthy Homes Environmental Visual Assessment Tool. This assessment includes the 7 principles of a healthy home, which are keep it ventilated, keep it pest-free, keep it dry, keep it contaminant-free, keep it clean, keep it safe, and keep it well maintained. If at the time of my visit I see any obvious sources of lead-based paint, I instruct the parent on simple measures to prevent the child gaining access to the lead-based paint. And this could be just like closing the window where the child has been seen eating paint chips out of the, when the window's up. It seems like there's always a lot of paint chips in those old windows. Or putting duct tape over chipped and peeling paint. I don't tell them to do anything more than that because they have to wait for the lead investigator. Sometimes if they want to try to do some of those, fix the problem themselves, it really could make it worse. So that I conduct an education session with the parent with emphasis on information related to the medical, nutritional, and environmental aspects of lead poisoning in healthy homes. I provide appropriate materials to the parent, such as handouts, videos, and cleaning supplies. During my visit, I obtained parent signatures on release of information and consent forms for all appropriate referrals, for example, Help Me Grow, WIC, and DCMH. After my visit, I created an individualized lead poisoning care plan with specific goals for the child and make appropriate referrals as necessary. Then I continue to follow the child by contacting the parent to remind them when it's time to test their child again until the child's lead level drops below 5.
Thank you, Elaine. Okay, I'm just going to wrap up with a few final comments, and then we're going to open this up for questions and answers. And feel free to ask any of the panelists questions, anything that we have yet to talk about. I was noticing as I was listening to the conversations tonight, the panelist presentations, that really this issue, we couldn't actually have a better partnership than we did in co-hosting this with the League of Women Voters, because the League of Women Voters is about informing the public, public health is about informing the public, and this is one of those issues that depends entirely on an informed public. It's an issue that affects the public. It's an issue that will require the public's action to do something about. I wanted to point out that another sort of serendipitous occurrence. This week is National Public Health Week. The President of the United States had a very long proclamation, which I didn't write down and didn't memorize, and it's very long. And the governor did as well, and declaring this week Public Health Week in Ohio. And one thing that I did notice as I was looking at those is that each one of the days of this week has a particular focus area. And today's focus area, the tagline for it is starting from zip, referring to zip codes. Well, this is, I wish I could say that we planned it that way, but we've spent an awful lot of time mentioning zip codes 43301 and 43302 in particular, and the number of folks that reside in those zip codes that are, well, everyone who resides in those zip codes is of elevated risk, multiple elevated risk factors, the high population on Medicaid, the age of the housing, and so forth. So I wanted to point that out. The other thing that I wanted to mention was yesterday we had a very good conversation. It was the first, it was a stakeholder conference with public health and our partners throughout the county across different sectors, and it was related to our community health assessment. The idea was that we were going to come up with a dozen or so sort of broad topic areas that we wanted to consider as part of our priority areas for the next 5 years in public health planning. We found the traditional ones, which I expected, obesity and tobacco use and drug and alcohol use and nutrition and physical activity and all of these things that need to be on that list. But because we had a variety of stakeholders in the room, we had educators in the room, we had elected officials in the room, we had businesses in the room, as well as the hospital folks and public health folks and providers and so forth. So we had some other issues that showed up on that list, and one of them in particular, I think, is germane for this evening, was access to safe and affordable housing. And this is a very good example of why access to safe and affordable housing is a public health issue. Because it's not just that that's a home, it's that that's a place that is full of not only hopefully warm and comforting things, but also some very dangerous things and some things that impact health. As we move forward from that first conversation that we had yesterday, we'll have a couple of conversations already scheduled in May. And I have, if I don't have your email addresses from the sign-in sheet, please do that before you leave. I'll email those dates to you as well, where we'll take those dozen or so health issues and prioritize to a smaller list of 3 to 5. And boy, it'd be great if folks from this room were participating in that conversation and assured that things like healthy housing was on that final list. Because again, as I said earlier, while it's a public health issue, the solution is a public solution. If we're going to have, if it's an approach through legislation, through housing codes, things like that, that doesn't just happen because the health commissioner calls city council and says, "Can we please?" It happens because the public says, "Hello, folks, we need this." And so this is really more than just a presentation to make folks aware of a problem, but we really want to make sure that folks are aware that they're going to be part of the solution. So with that, I will close. Thank you all for coming. I do want to remind you again, after we do the questions and answers, you all, I think, have a sheet there that has on one side before and then one side after. If you'll make sure you answer both sides of those, it's a sort of a pre-test, post-test model. Our original plan was to say, do those, turn those in, and then you'll be eligible for a cleaning bucket. Chris had mentioned the value of doing wet cleaning. We have an example of that bucket over there from Ohio Healthy Homes and Lead Poisoning Program. I can read it from here on that arthritis. The good news is, I mentioned something about good news is, there's a high probability that if you turn in those sheets, you will win one of those. Because our population health director's office looks a little bit like Home Depot right now because it's full of these buckets, and we will be anxious to share them with you all. So with that, please, if you have questions, now's the time. Please ask them, and we'll do our best to answer those. Yes.
Your Roseanne Roxanne's story about Lucy, and I'm kind of combining that question with Dr. Jankar's requirement that 1- and 2-year-olds be tested. Well, now somebody, were her grandchildren, Lucy's grandchildren, only 1 and 2 years old, or how were they tested? How did somebody find out that they needed to be tested?
I believe she did have a 2-year-old. And, you know, the thing I wanted to mention is even though it's mandated under Medicaid, I'm not sure what that means. It's codified, it's in state law, but that doesn't mean that if a person doesn't have their 1- or 2-year-old tested, they're going to have their Medicaid discontinued. It doesn't mean that. So that even though it's required, there's not much of a consequence.
But if a child is tested at 1 or 2, and you said that Medicaid families usually grant, what if the child has no indication of lead poisoning, then moves to another house? Who's going to test that child? Again, maybe there's the next house is just as old as the first one, which has the lead paint. How does the child get tested?
He would have to be tested. The only other time would be when he was 2 years old. If he was tested at 1, he moves.
So what if he gets tested at 2 and he moves at 4? That's my point.
Okay.
The Ohio Department of Health does recognize that issue, and so our recommendation is that if a child does initially test with a lead level less than 5 micrograms per deciliter, if they do move to another home built before 1970, it's recommended they be tested again, even if that initial test was less than 5. You'll see that when you get a chance to look at these. The recommendation
The
is.
doctor has to know, some
That's
public
right.
health, somebody has to know.
Well, we also, when we receive notice of high levels, we maintain that information in our case as well. So even though that child would move, we would still have that information, and actually, it's advised for parents to test, continue to test children up to 6. So from our standpoint, one of the problems that we see on our end in terms of education is just the fact that people move so often. And sometimes, and as you said, they may have a situation and contain it there, but 2 months from now or less, something in their life happens and they have to move. And you're right, they're moving into similar housing stock in the same zip code, and that danger is potentially there again. So it's a challenge, I think, for all of us.
And this really underscores Dr. Jenkar's point earlier about the role of prevention. And yes, we need to make sure that everybody's getting screened. Absolutely, our screening rates are horrible in Marion. 20% is not cutting it. That also has implications not only for the child in detection, but it will have implications on not having sufficient data to move legislators into action. They're loath to do anything without strong data that says there's accountability if you don't, because we've shown you what happens and where we are. So there's that, but then there's also on the front end, while it's wonderful when folks can have one place that they call home, just like it's wonderful if they can have one place that they go to seek their medical care, the primary care home as well as the residential home. If those homes are all safe, that is much less of an issue. So it really is not just one solution here. There are multiple approaches. Yes.
Well, like the one example they was talking about, children with their grandmas, and she was taking care of them. So there's an example of old health. It's an old person that doesn't have enough money to maintain it. We have a lot of that happen. And I guess in our society right now, there's not enough money to help low-income people stay in their own home and update it. Like put siding on it instead of painting it. Make sure, they get rid of the lead, or insulate it so that it won't get expensive, either expensive to heating and everything. So that's a serious problem, actually.
It is, and it's not solely with the lead abatement problems. We have the exact same problems with maintaining septic systems, right? These are owning a home is a tremendous responsibility, a lot of fiscal responsibility, and folks are struggling to get food on the table, much less abating lead and keeping septic systems.
Well, a lot of people that rent, if they're low income, if they're renting down some kind of assistance, normally the people who rent to them, their houses are inspected because they have to pass certain codes.
That is, in some places, that's the case. Yes. Oh, goodness. A whole flurry in the back and the
All
right.
right, what about an older house that's, got old paint on? If they just covered up with aluminum siding, is that safe instead of not removing it first? Is that?
Chris, I'm going to pump that over to you.
Yeah, and tacked lead-based paint is typically not an issue. In some of the control methods, and I don't want to speak specific to any particular house without someone writing the order and all that, but sometimes that is a recommended control method, is the placement of aluminum or vinyl siding over existing siding, and actually creating basically a chip trap that keeps any chip that falls underneath that layer of siding contained within that new siding. So that method is used, but it depends on the property, and the folks that write the orders determine what methods are allowable.
I have two friends, one girl. The boy tested at level 5, and the girl tested at a level 6. They just told me, "You don't worry about it until it's over 10. So come back in 6 months and we'll retest." That was just 3 months ago. Is that normal?
They would have told you that 5 years ago, but they're not supposed to tell you that now.
That was just 3 months
That was changed. No, actually, 25 years ago, it was 15 micrograms. And 10 years ago, it was 10 micrograms. And then 5 years ago, it was changed to 5 micrograms.
You actually see a doctor that you work with.
Oh. That thing that says 5 micrograms, I got it hanging right above my cupboard that I look at all the time. And she knows that because I call her every time it's over
No one
5.
from your office called me. No.
Really?
How long ago was it?
It's when they were tested in December.
Yes. We need to talk. Yes, we do.
Thank you for sharing.
Yeah, and they just said, test again in June, and as long as it's not over 10.
We'll talk after.
Yes.
Okay, you talked about the cost of the test. Does Medicaid cover the total cost of this for people on Medicaid? I mean, you talked about it from the doctor's standpoint.
Medicaid does provide reimbursement for the test, but I'm going to say like every insurance, they probably don't provide reimbursement at the same level that.
All right, reimbursement, let's say I don't have much money, that means I still have to pay out the, what is it?
No.
$25?
No, you don't. Not if you're on Medicaid.
Okay, then don't, Medicaid.
Medicaid
It's
pays
not
the
reimbursed.
doctor.
Reimbursement of the doctor.
So what is the cost to, is there any cost to the person on Medicaid? Okay,
No, no
cost.
cost.
What about if you don't have Medicaid? What if you have other insurances? How do they cover, some of the cost, all of the cost, or is it?
It depends on what kind of insurance plan that you have.
So let's say you had no, good heavens, nobody can have no insurance, but what if you didn't have any insurance? What would be the out-of-pocket cost if, for a test? I mean, somebody's got to know what would be the, what would I have to put out if I had a child who was 1 year old that month? No. This is somebody who could pay for it. They're not on Medicaid. What does it cost them?
Well, we rarely have anybody that comes into the health department that doesn't have some type of
I
insurance.
understand
No,
that.
but I think our fee would be $25.
Okay, is that what?
And ours is a capillary, like
Yeah.
the finger stick,
Yeah.
not the finger function.
But I mean, this is information that we should know what it is. Because there may be people who say $85 and they want me to come back in 3 months and have them tested again. You know?
So yeah, there are multiple variables on both sides of that, right? There's the, if you are eligible for Medicaid but don't have it, if you have Medicaid, if you don't have insurance, you have insurance, you don't
I mean,
have, or you don't have any
nowadays,
insurance.
most
There's-
everybody's supposed to have.
Right, so there are all those varieties, and those insurance companies are going to reimburse the provider at vastly different rates. If you're out of pocket at the health department, Elaine just said it was $25 out of pocket at the health department. That doesn't mean that it's going to be $25 out of pocket at some other provider. And again, you could have 1,000 different answers for that question.
So you would have the cost of an office visit for that provider and whatever the lab cost is.
But I'm wondering if that is a deterrent for some people to say,
But the way he's putting here, it's the doctor.
It's the doctor who's not getting paid for.
yeah, I
Right.
realize that you were addressing that, but I'm talking about the person with a 2-year-old and a 4-year-old and a 1-year-old. You know, I just think that's something.
Most of the time, those kids are going to be on Medicaid. It would be very important if they had no
Okay.
insurance.
So it's also a wonderful time to get them enrolled in Medicaid if they show up and don't have and are eligible for it. Rose.
So I would like to ask each of the experts if there's one thing that we'd like to see us as a community do to try and improve the testing rates so we get a good picture of how many children might have lead in our county, because of all the testing, 1 out of 5 that should be tested. And also, two-part question, what is one thing that you'd like to see us do to improve the testing of children who might be lead poisoning? And then what is one thing you think we should think about doing so that our community housing is safe and we don't have children going into unsafe housing?
I'll start, not being one of the experts, but I'll start.
Thanks,
I'm an expert at giving other people time to think about that. The one thing that I would encourage everybody in here to do is to share the information, or as much of the information as you remember from this evening, with your greater circles. We live in a world of social networks, whether those are actually virtual or real. Everybody here is connected to a number of other folks. The public health information is spread through the public, just like communicable diseases are, but not as deadly. So spread that information, and share the importance of having folks get screened. Be amazed at when we talk to brothers and sisters about nieces and nephews, and even when you're talking about vaccines, and the low participation rate there, we can have those same conversations that you would there with regard to lead screening, and encourage folks to go get screened. In terms of the housing piece of it, it's a wonderful invitation to repeat myself from earlier and say we have a couple of public meetings coming up that will focus our community health assessment health priorities. If housing is one of those, safe, affordable housing is one of those, that will help us in public health and help our partners in the greater public health system in Marion, which isn't just the public health department, create that energy, create some noise, create some movement, to at least on the regulatory end of things, be able to say, hey, look, we need a code that says you can't rent unless. That one probably got me in trouble.
How about you can't live there unless? How about doing building codes?
Building codes would be nice as well, yes.
We've had that on our agenda for 20 years.
So I'm a proud member of Marion League of Women Voters and chair your agenda. Okay, now I stalled a little bit, so somebody else.
Yeah, actually, Tom, I'm glad you led that conversation, because there are two things that occurred to me primarily. In terms of the testing rate, and I mentioned, we have just a challenge in sustaining communication with people that we have on our Medicaid enrollment rolls, because people move, because they may have, in the course literally of a month, people may have 3 separate addresses, and they don't always have it as their priority to tell us. And, that I think is reasonable and to be expected. So we have to find, for us, a better way at sustaining communication. And I think Tom's suggestion about social circles is an excellent one, because people do communicate very well within their own social circles. Our agency is not the nexus of their social circle. So we need to do a better job at that, or finding different avenues to communicate that. And people generally have so much going on that they don't remember that information until they really need it. So to have it easily accessible when they do need it, and to spread that social network again. So communication is a big deal for us. And in terms of the housing, I moved to Marion from a city that had probably what would be considered very restrictive building and housing codes. The city of Pasadena, California. And literally, you couldn't paint your front porch without getting some special permission. So I'm not maybe recommending that, but I would say that it would go a long way to have some code or some structure, some guidance. I think the challenge with that is then you have codes, then you have a need to enforce those codes, and you have a need to provide education and training, and then you're going to have to rely on contractors to mediate, and those contractors need to be licensed. So we're talking about money and infrastructure to sustain that code enforcement.
But it also sounds like some economic development opportunity.
Correct.
So, I mean, it
The money is
can
not
go both
there.
ways.
The money is not there, because it's costing a lot of money to do all that. I'm just saying, the money, if you have $10 million just to use for a while, it would be great, but it's not there.
One of the things that I came to Marion from the Akron Health Department, and something we had up there that I would love at some point to try to replicate down here to scale. But we had a couple of large grants, one from the CDC and one from HUD, to address lead poisoning in Akron. What the health department was able to do up there was to purchase 2 houses that they rented out to folks so the folks could live in those places while their houses were being abated. They also had interest-free loans, and there were some grants also available that truly were grants. I mean, it was we'd like you to pay us back to keep this thing floating, but we know you can't. Now again, the health department doesn't have that budget. Our entire budget would last about, a couple homes. but if we can get, if we start with a meeting like tonight, we get folks getting screened, we get a better understanding of what our true rates are, we make some noise locally, we say, hey, let's work with lead abatement professionals as well as the local elected officials, as well as some other contractors, do joint applications for some of those federal dollars. Those federal dollars are still out there. Lead poisoning is a national, national
Well, why are you
problem.
doing the lead poison abatement? At the same time, you take care of the energy too, because most of the houses, you just blow right through the houses. There's no conservation. You gotta pay a big heating bill in the winter and a big cooling bill in the summer. So if you do both at the same time, that will definitely save a lot of money for the homeowner afterwards.
Wait. I'm sorry, Roseanne. Rosemary.
Well, I think Roxanne mentioned there's 5 managed Medicaid plans that you can be on. And it seems to me that people have to look at what kind of results these plans have, because this is, a bid process and they have to be awarded, but I think you need a track record. And track records like the percent of 2-year-olds that you got immunized on your plan, the percent of 1- and 2-year-olds who had their lead tested on your plan, things like that. And the ones who have the better track records are the ones that should be still in business. Maybe we don't need 5 Medicaid managed plans. Maybe we only need 3 that do a good job. But you have to be responsible for what you're doing. So it's either you give a profile to those plans, or you give a profile to the doc and let him know what percentage of his kids don't have this or don't have that. But they don't do that. They'll give you a list of who didn't show up or who has which disease, but it's up to you to try and do that. And I have gotten those lists, and I kid you not, I have had people in my office make 250 phone calls, and close to half of those numbers are not working numbers, okay, to try and get people in. And then out of that list, you're probably going to get maybe 15%, and then half of those are not going to show up, okay? So there's a responsibility thing here all the way around. The ones who are paying for the care for these people, the doctors who are providing it, and the parents themselves who have the kids that don't take the responsibility to even have the kids come in for their appointment.
But doggone it, I've worked all day, and I've come home and I've got to get a meal on the table, and I've got 3 kids to feed, and listen to their story, listen to their reading to me, and get them to bed, and I don't have time to be concerned about prevention.
That's where Grandma comes in. Grandma can take them to the office.
My mother is dead, so I have to rely on a neighbor or somebody else.
Well, and you know,
I'm putting out a case.
Sure, sure.
the conversation has sort of been brought back into light about home health, the community health workers. And I mean, that's old school public health. That's the way it was done. And those are the folks that would go out and they were skilled. They weren't typically public health nurses, but they were supervised by public health nurses. They had sufficient education to go out and promote a number of the preventive actions that need to be taken. You know, we don't live in a stagnant, unevolving public health system, and so some of these things come back around, and so that may be part of the solution at some point through down the road. You know. And sorry, there were a couple of questions in the back.
So, kind of as a follow-up to this lady's question up front, and this is kind of directed towards Chris. So, in your presentation, you were talking about how the Ohio Department of Health has the lead risk assessment people come out and do, and they issue orders. And this is more looking at it from a preventative landlord housing stock, affordable housing stock here for our communities. So the orders go out saying, landlord or homeowner or whatever, you need to abate and do this remediation. Here's what the issues are. A homeowner, landlord / doesn't do that. And then you send out the non-compliance orders and saying, you know, the house needs to be vacated and all that kind of stuff until you've remediated. So how is the department enforcing those orders? Do you have attorneys on staff that then is going out and filing lawsuits against those landlords to prevent them from going out and you know, re-renting that housing stock now that they've been informed? So how does the department have any enforcement mechanisms to enforce those orders, I guess?
That's a really good question, and it is tricky, as you can imagine. We are, you know, just a small group in Columbus, Ohio, to try to monitor properties around the entire state. We do work with about 15 local health departments to do that work themselves, so they do it on the behalf of the Department of Health. They're delegated authorities to do that work. But we're in, I believe, part of all of 83 counties in the state, and there's 88 counties in the state. We do luckily, we have an enforcement coordinator, and her job is to work with the property owners to get the orders lifted, eventually, no matter what stage they're at. So these are properties that are with just the first order, or obviously have the notice to vacate as well. When we have a repeat offender, in the sense that they're removing placards and putting new families in the home, those are turned over to the AG's office. No, we do not have the ability to do any type of prosecution out of our office. I don't know how they do it in some of the other local health departments. Some of them have housing courts that they turn them over to and things like that, like in larger cities and counties. I can't tell you what percentage of those cases get taken on by the AG's office. I'm not aware, but you're definitely onto something. It is difficult to monitor those over time, and then to do anything about the folks who refuse to comply even after that order non-compliance.
Another situation that's not just focused on lead.
Yeah.
Yeah. Issue a lot of orders. Yes,
All right,
back over to
if a landowner has a problem, could he rent to people without children? Because how can he afford to redo this rental and not raise the rent? You know, could he rent to somebody that didn't have children and still rent the house?
It would depend what the code was. Again, up in Akron, where we had a code, it was they weren't able to rent to families with children under 6. Unfortunately, what some of those landlords did, and what some landlords do, who really shouldn't be in the business, quite honestly, will evict those families and then rent to families without children.
Let me just add that once the orders are issued, though, it doesn't matter where that family goes, the order stays with the property. So if the child moves out, they still have to deal with the order that's on the property. Now, if you're talking about I don't know if any landlords are thinking that proactively to not rent to children to begin with. If they think they have lead-based hazards in their house, they're then renting it to children or families without children to avoid ever having an order.
They were up in Akron.
Yeah, they may be more well aware of the issue in Akron and Cleveland and other areas like that. But that's interesting.
There's a code here.
That's correct. Yes.
So say you have a family, a young family starting out, they have young kids, they go out and they buy their home. In this area, it's more than likely going to be, a starter home, an older home, maybe not well maintained, and the family is maybe, trying to avoid either resources or, information out there to give to those types of families that maybe don't have the Medicaid that are able to get those types of resources to kind of try to help be proactive. Maybe they can't afford to have the home professionally remodeled. The DIYers, so to speak. Are there resources out there to either help pay for a professional or websites that can help the families do it in a safe manner to have their kids, not be harmed by it?
Yeah, the EPA does put out a lot of information on how to work lead safe so that hopefully those types of families are getting a hold of that information, but are they aware? In many cases, probably not. Our HUD grant that we do have in some counties in the state does allow us to provide some of that same lead hazard control work in properties that have not yet poisoned anyone. But we prioritize families who already have orders on their property, and even landlords with orders on their property, we prioritize them in many cases over someone that does not have a current lead issue. So yeah, you're obviously pointing out a hole in this whole process, that we're not doing the primary prevention that we just talked about, how it's so important.
But it seems like that could be added to sort of the general knowledge of things that one needs to look at before they buy that house, right? Along with, does the plumbing work? Does it have the electricity work? Does it?
I don't care about that. It's what I can pay. Look at a bunch of houses that have grown up on the west side of Bartram Avenue, just south of Fairground Street. And I can see the 2x4s coming through the outside surface. I can see where the 2x4, now that's not very produced house. I mean, and there's a whole row of them. Somebody bought those, either as rental property or because that's what they could afford.
Yes.
Well, when you talked about buying a house, okay, normally, even when you rent an apartment, we get a little pamphlet that talks about lead, and people should take that serious when they rent or buy, because it tells you about lead in that pamphlet, and they have you sign that. So right there, the house was built before 1978, so you might have lead in there. So if you buy a house, and they've been talking about this for a long time, this is not happening today.
Well, there's a reason it was banned in '78. They were talking about it in '78.
But I mean, what I'm saying is everybody gets this pamphlet. If
Right.
you rent from someone, you don't get that pamphlet, you're supposed to get it. Okay, it's the same when you buy a house, you're going to get it. That doesn't always say that they have lead in there or anything, but it does tell you if the owner knows or if he doesn't know. So you got to keep that in mind.
Good point. Do we have any, yes, another question?
This is a different kind of question. We've been talking about identifying the children that have high levels of lead. I'm curious about, and maybe I missed it in the presentations, what happens once a child is identified? What happens after that?
Well, that's what when I get the report, I do the lead case management. I make the home visit and give educational materials. And then,
I mean, is there treatment for it?
Yes, for higher levels, if it's at that
45.
Yeah.
Yeah, is it 45?
Yeah, it can be referred to Nationwide Children's to toxicology.
I'm sorry.
Dr. James, I don't think you heard.
If the level's over 45, they usually need chelation therapy. So we usually refer to Nationwide Children's to the toxicology.
So there is a therapy.
There is a therapy, correct, right.
For that.
Right.
That was my.
Yeah,
Right.
that's what those much higher levels than, you know, than the 5 that we're talking about.
Than a lower, but still noxious. I mean, you don't want a child.
Absolutely, there is,
Children
as
going into
Chris said
that.
earlier, is no safe level has been
Right.
determined. The idea is that if you identify 5, you've identified a risk. You want to make sure that
So
you're,
the level really stays with you. Is that what I'm hearing?
Well, it will go down as the source is removed. Because the child's exposed to it, he's not going to eat dirt anymore, he's not going to put the paint chips in his mouth. But if the level's high enough, it still can be stored in his bones.
That's what
And at a
I'm-
later point in time, it can come out, even though it's down. So you need to still continue testing
Okay.
on that, yes.
I don't see any more hands. I want to thank, oh, yep, there we go, yes.
If you're gonna have your windows replaced, I know you have to worry about paint on the seams and the sash on the sill, but how about actually if that's all taken care of, about anything in the walls?
Chris?
Sure. So if you are talking about having a contractor do this work, you want to make sure they're RRP certified by the US EPA so that they follow that rule when doing the work. They assume if it's a house built before 1978, they have to either assume that all surfaces have lead on them or do testing to rule out. So any component of the window could be painted with lead, but including the walls next to the window as well. So if they're disturbing any lead-based paint, they would have to work in a lead-safe way, which again is really just, a lot of that is containment and cleaning. So they're going to most likely charge you extra for working in a lead-safe manner, and none of them even will itemize that amount on the quote, because they're being required to now do this by the US EPA.
And what does it look like? What can the consumer see that the contractor?
Well, similar to we talked about the lead disclosure, and I'm really glad you brought that up, which is required when renting or buying a home before 1978. These contractors are also required to give you a pamphlet that is about the RRP rule and working lead safe, so you have a guide in your hand to know what to look for. Very similar to the how it was done with the disclosure pamphlet.
Well, when they work, let's say, they're gonna cover everything up before they start, make sure everything that falls off is gonna go in plastic, and when they get done, they're gonna clean it, they take everything, they clean everything up, and that's basically it, okay? Now, if they work more, there's more to it, but just taking the window out, on the inside, if it falls down, on the outside, if it falls down, you have something there, so they can contain it.
But the contractor pays for that certification, is that correct, or like?
Yep.
They do.
Okay.
I have a sneaky suspicion we have folks that know what they're talking about. Okay, well, again, thank you all very much for coming. Lee, thank you. And my staff who are sprinkled throughout the audience, thank you all for coming too. I'll have to fill in the gaps here. This won't be the last time we have these conversations. This is currently the only one that's on the schedule at the moment. But please stay tuned, because we will have more conversations like this. This won't be a one and done on the lead issue, I'm sure. And so, keep it in mind, talk to your neighbors and family and friends. Thanks again. Have a good night.